Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our Plática called Take Action LA County. I'm excited to be here with you today, and I'll be introducing our presenters in just a little bit. NALBA is a nonprofit agency dedicated to the well-being of Latino individuals, families, and communities across the United States, including California. Our mission is to address the disparities and the barriers that affect the behavioral health of Latinos. Today, we're excited to present our Plática series called Take Action LA County. It helps us to reduce stigma and to connect resources to the individuals who are seeking help for mental health. And with that, we want to ensure that you know, as a plática, which is a Spanish word for the word conversation, you get to participate in this conversation with us today. So the live Facebook audience, you get to make comments and ask questions of our presenters, and it'll allow us to have a wonderful conversation so that we can all benefit from ensuring that we address the stigma that's facing many individuals in LA County. Well, we'd like to thank, of course, the County of Los Angeles, the Mental Health Department, for being able to make this series possible. Each month through June of this fiscal year, ending at the end of this month, we're going to host these pláticas to ensure that the community can learn more about what is available in their community to help them. So with that, we're excited to get this series started here and to get our plática going. So let me introduce our wonderful presenters today who were very gracious in accepting being able to participate in today's Plática. So let me start with Roberta Shintani, because she serves in a very important role as the executive director for what is called the Coalition for Engaged Education. She has been there for at least 7 years, and while seeking her desire to give back and give thanks, Roberta has joined the Coalition for Engaged Education, which is a nonprofit organization in Santa Monica. As the executive director and CEO, Roberta uses her cultivated skill set to fundraise and advocate for young people impacted by the juvenile justice system and or those who are in foster care. And with that, she has a great depth of understanding about how youth look for guidance, look for support, and Roberta strives to be that key contributor. And by doing so, she's making a positive impact on their lives in order to so that they can reach their full potential. So Roberta, I'm so glad to have you here with us today. And I'm going to also introduce your colleague, Bertha Cordova. So Bertha comes to us also from the Coalition for Engaged Education, and she's a mobile case manager. So that's going to tell us a lot about the fact that she doesn't sit so much in the office, but she's out in the community, right? And with that, the work she does for the coalition is so significant because, she has said many times, having personal lived experience with foster and juvenile justice systems, she's driven by making a difference in the lives of the youth that have experienced challenges similar to her own. So she speaks from experience and expertise. So Bertha is a trauma-informed individual because of the work that she's done, and she also is giving back to the community by helping young people get off the path of grief, destruction, and homelessness so that they can reach their goals, their potential, and keeping them safe, and of course keeping their communities in place. So with that, those introductions, I know those are kind of like the official introductions, but Roberta, I'm going to ask you to say a little bit more about yourself, and then I'm going to go over to Bertha and have her say a little bit more about herself so our listening audience can really get to know who you are, and then we're going to get started. So Roberta, welcome once again.
Thank you so much, Fred. I appreciate it. First of all, I love my job. I don't know how many people can say that after all these years, but I've been here, actually, he said 7, it's more like going on 9. It is so rewarding to be able to work here. As you heard, we are in Santa Monica, but that's just, the admin staff. That's where I sit every day. But our case managers are mobile. So what we do is we try to reach all of LA County and support young people in their journey out of jails, out of camps. Of course, they're in and out sometimes, but we do mobile case management. And what that means is we meet each youth where they are, physically, mentally, spiritually, emotionally. There's a lot of trauma. There's a lot of, young people experiences that they really need some sort of guidance and support. So that's what our mobile case managers do, like Bertha. We go, we meet them where they are. We do an assessment, see who they're living with, who they're hanging with, et cetera, et cetera. And then we say, what do you want out of life? And we try to establish goals with them, little benchmarks. Every youth is in a different place of their life. A lot of them are dropouts. Some of them are young moms and dads. You have those who are like homeless. And we have a lot of drug addiction going on as well. There's, of course, there, communities of gang, violence and it's home to some of these people. So it's something that our case managers really have to take on a case-by-case basis and go and work with each youth. Now, in doing this mobile case management, one-on-one touching, each youth, we also offer workshops. We like to take our young people out of their communities. They're just in this cement jungle day in and day out. And it's really nice to be able to take them to Los Angeles Forest and let's go camping, or we can take them to, bowling or the museum or places where they don't usually go. We had one youth who was, just turning 18 years old, and he was having fun making a snowman up in, I think it was Big Bear. And he stopped and he said, oh my gosh, I'm acting like a little 5-year-old. And we said, please, go on. He was laughing so hard. We had never seen him laugh that way. And it was just so joyous. But again, if we take them out of their community and expose them to something different, then a lot of times they can become, their true self. We are starting something called Surf Bus. How far is it from South Central to Santa Monica Beach? Not very far. A lot of them have never been to the ocean. So we teach them how to swim, but more important, they're learning how to surf and they love it. So we're in, community with different, we form partnerships with other nonprofits who can provide our youth with this type of exposure and opportunity. We recently went to a place in Woodland Hills called Stand in Balance, and it's an equine psychotherapy, environment, but more like for them, it's just, how to get in touch with yourself and how to, be okay with who you are and experience your sensitivities. And it's a one-on-one with each of the donkeys or the horses, and the youth are able actually to sort of let go of some of their fears. It's just an amazing opportunity. How many of us, especially from these communities of low wealth, get an opportunity for something like this? It's quite expensive. So we try to provide these sort of opportunities to them. I'm sorry if I'm going off on a tangent.
Well, you were covering the second question at the same time, but that's great because really that's a nice segue. But we want to know more about you. So your passion for the program and the kids is incredible. But who is Roberta? We want to know what's driving you, what's your passion, and what is it that drives you to do the work you're doing? Because so telling about the organization, right? The person who's at the helm, right? But more importantly, who is Roberta? Tell us about Roberta.
You don't want to hear about my boring job, about going after grants and, doing things like that and making sure the cash flow is working. But yeah, that's who I am. I am a CPA by background, but that is like in my very early years. And of course, given that background, it afforded me the opportunity to see how to grow an organization, with some HR experience as well. I'm able to build a team. So that's who I am. I come from the business world and the for-profit world. And with that, I always felt that it was great. I was flying around the world, first class, making movies. You talk about $100 million, that was nothing. Can you imagine the cost of one film invested in our community, what that could do? Well, I segued into this because I was coming in to help save the organization from financial downfall. And through
Sure.
that, my heart just opened to a whole nother world. And it has really touched me to see not only the struggles, but the successes, of these individuals that we're helping. And that's what keeps me going. We had a
Great.
youth last year who graduated from Duke University with his PhD. He started with us as a young man in juvenile camp. He started cooking crack cocaine at the age of 8. There was generational gangs in his life. And so through working with him one-on-one, we had an amazing, amazing counselor who stuck with him throughout camp, outside of camp, chasing him in, Las Vegas. Well, by communicating with him, he came back, enrolled him in school. He dropped out of school, went back to school. We had this one counselor that wouldn't give up. And we're so proud that he finally, what we call, made it, right? By graduating with a PhD. And,
That's
we're in
just
communication
amazing.
with him. He wants to give back. He's an amazing individual, but we do see the potential in every youth. And that's why I do what I do. Accounting doesn't sound like fun. It isn't fun, but if I can use that to help the organization to stay financially stable and to grow the organization, then this is where I belong. And I have never felt more fulfilled doing this than, jet setting to Europe first class. I'm telling you, that just
Well,
doesn't
that's
compare.
how wonderful that is to hear that, your expertise, your experience, your background lends itself to a leadership role for a nonprofit organization who does depend on the charitableness or the benevolence of the community so that funding and grants and other resources can benefit the work that you do. So, Roberta, thank you for sharing that. That's just so telling. And I'd like to ask Bertha the same question, is to tell us a little bit more about herself. And then we're going to segue to talk about the services, right? Because we want to make those services available to even more youth, like the young man you described. But Bertha, over to you. Give us a chance to learn more about who you are and what your passions are and why you do this work.
So, like you said, my name's Bertha. Um, I've been doing this work for maybe about 20 years already. Um, I love what I do. I am one of these youth. I do identify as one of these youth. I do come from the community um, of the whole gangs, drugs, incarceration. Um, I first started doing this work when I met a young lady that didn't have nowhere to go, and she was in the same neighborhood I was in. And I would kind of just started, wheeling her in. Do you need, you want food? Do you want a shower? She was a little girl, 14 years old. And she kind of opened up the door for me to do this. I seen the need in our community. Um, I seen the trauma in our communities. I seen the stigmas in our communities. And, I had done so much damage, in my community, that I felt that, what, I have to give back. I want to give back. I want to heal our community, didn't know where to start, so I realized you start by one person, you start with yourself, and then you're able to pass on what you've learned to other individuals in your community, and by educating them. I have 5 kids, 6 with the young lady that I finally adopted, because we ended up adopting her. I don't ask me how we got her, how they gave her to us. You know, by the way that they spoke about her, it kind of felt like they were just throwing her away. Like they didn't care we were gang members. They didn't care about anything that, nothing about our background. It was just like, oh, you want her? Here she goes. You can have her. So it was kind of like a throwaway, like, you guys deal with her. We can't do nothing with her, and she was a young lady that had gone through so much, but again, by not giving up with her, by chasing her, by giving her love, by knowing that we're not giving up on her, we were able to navigate, different roadblocks. And unfortunately, at this time, she's now 37, and but she fell back into drugs. But for a moment, we did have her to where, we were able to get her into school. She was going to college. She was doing great, and that was because we didn't give up on her. We chased her. We did whatever we had to do. I myself am a former gang member, and, been incarcerated. I also was a foster youth. And, it was not something that was fun. Those are not good memories, but being in therapy for almost 20 years has helped me, to heal. There's still some things that still come up, and I have to run back to my therapist and, and be like, hey, I don't think I've healed completely from this trauma, but I'm able to put a name to it. And I've been able to educate myself on what trauma is, instead of them people saying like, oh, we're weak-minded, us people in our community or us gang members don't get therapy, because that shows weakness. I've been able to educate myself, and I've been able to educate others as well.
That's just amazing. Wow, you have quite the success story, ¿verdad? And what I say it that way because it's good to give credit where credit's due when something does work, right?
Yeah,
Because
thank you.
we work to try to improve our lives and to kind of restore it to some way of having a balance that's important for ourselves, our children, our family, our community. And you're just in part really describing it and then giving back now in addition to all of that, right? Because our working ourselves is a lifelong journey, but when you get back to the community, that's the work that you do. So, well, let's kind of segue to about the work you do as an organization. And then Bertha can even give us yet another example of services. So, Roberta, back to you. So, you and I are going to get into the elevator at the lobby of a downtown hotel in Los Angeles. So I'm going to the 18th floor and you're going to the 20th floor. So we're going to be in that elevator for a little bit. So what would you tell me about the services you provide in your organization? And then when we get to the 18th floor, I'm going to meet up with Bertha and I'm going to ask her a question about telling me about what is it when you serve somebody? Give me an example. So we're going to kind of tap on both of you to help us learn more about your services. So go ahead, Roberta.
Okay, we're starting on the floor. Do you know some of the communities in our own backyard? Here we are in this nice hotel, but there are kids in their own backyard. Guess what they need? Things like employment. They need advocacy when they're fighting a case or getting picked up. They also need, personal development. Who are you? Where are you headed? I mean, these are the things that we are there as an organization to attach a case manager to each one of these youth who are, lost, struggling, running amok, you name it. But they're our future. These are our leaders of the future. And if we don't help them today, they're going to lead us astray. We're going to follow them into, inferno. So this is what we do. We are here to receive and reach these young people so that they can get whatever needs they have met, and also to set up goals and achieve them.
Oh,
I think
wow.
we hit the
Wow.
20th floor.
Well, I come out of that floor saying, wow, God, there's a need in our community. So you just did that for me, right? Listening to what you said, I would come out saying, well, gosh, what can I do? Or how can I help? Or, well, how do we get kids to you? And so let's say I make a referral and Roberta picks up the phone and Bertha, take us down that journey, how you bring in a youth into your organization, what happens in those next steps, so that this way somebody can envision who's listening to this now, right, or witnessing this on Facebook to say, gosh, well, that's what I have to do next. So then you're giving them like a little roadmap into your agency. So describe that a little bit for us.
So when we start engaging our youth, it could either be by a phone call, it could be by a text, via email, or we go knock on their door. They're not going to get rid of us that easy. You know, we have when they're not answering, they're not nothing. We send them a text, hey, you know, I see you're not answering. I don't know if you're home, but I'm gonna stop by. Usually they'll call. They don't want nobody in their house, so they'll call. You know, and it's pretty much getting, you know, building a rapport. I like to do FaceTime. When I send a text message, I'm able to see whether it's green or blue. I have an iPhone, so it'll turn blue. Most of these kids have iPhones. I haven't had one kid, I think, that has a Android yet. So I'm able to FaceTime, you know, can you FaceTime? Because I want them to see me, you know, I want them to get to look at me. You know, I'm full of tattoos. If you can see, I look like the kids in the community. So, you know, once they see me and we start talking, you know, I'm not very formal. I'm not a formal person with them. You know, it's kind of like I meet them where they're at, you know, excuse the word, but if they want to bullshit, we will, you know, and it's kind of like meeting these youth, you know, exactly where they're at, you know, talk their language. And as we go on, you know, we're building this rapport with them to where, you know, the youth get comfortable enough to express what they need, you know, and it's kind of slowly giving them that time to get to that part where they're able to say, you know what, miss, I need help with this, you know, I can trust you enough to know that you're not going to go anywhere, and that you're not going to give up on me, and that you're going to really be able to help me, you know. So being able to have that with our youth, that rapport, you know, it's essential with the kids that we service, you know, whether we're meeting them, you know, in the juvenile hall, whether our foster kids or they're homeless, you know, but just making sure that, you know, we're able to give them one of the things that for me has worked. It's breaking bread with them, you know. Who doesn't want to eat, you know? So I'm often telling them, you know, hey, come on, let's go eat. You know, it doesn't matter if I gain weight, you know, I'm willing to gain weight with you, you know, just you know, just to break the ice. And they like to go eat, you know. So at that moment, it's engaging our youth and talking a little bit about, like, you know, tell me about yourself. You know, sometimes they're a little resistant, they don't want to tell you, you know, but it's because they don't know you. You know, we come from those communities of not trusting people, because people use what they know about us to use it against us, you know. So helping this youth understand, look, you know, well, how did you get my referral? Oh, well, we got it from, you know, probation or everything. So right away they're like, I don't know if I want to trust you, you know. And then it's kind of like, wait a minute, but we're not probation, you know. I'm here for you. Like, I'm here to help you out, like navigate through the system and help you understand your terms and conditions, you know, so you don't do the same mistakes, you know. So how, you know, how do we help you? I'm here to go against what they want, you know. Sometimes they want to lock you up, and I'm here to tell the judge why you need a second chance, you know, and how helping, you know, letting you work with us is going to help you benefit, you know, from being a good member to our community, you know. So just building this rapport with these kids, you know, it's not that hard, you know. A lot of these kids, once they see us and they see that we look like them, we talk like them, we come from the same communities, it's not that hard for them to open up. It does wonders when they see the way we look.
Yeah, well, that's absolutely right. You know, it's like a match. You know, it's like a mirrored match. You know, you look like them and they look like you. They talk like you talk like them. You feel and have experienced the same things they have. So that commonality helps them to know, hey, well, you know, she knows what she's talking about, right? And youth are always naturally going to have some defensiveness because they have experienced things that have caused that reaction. And you were very nice to describe how your approach is very personable, and you're absolutely right. Teenagers are very hungry beasts, right? They definitely have an appetite. But it's exactly how culturally people relate and connect to each other, right? It's the way that we all, as you said, break bread together. So that's a really great example of how the organization works. So today, here we are, right? We get to have you here live on Facebook to talk about the organization. And so I'd like you to talk about, Roberta, what you are most proud about as an organization. And I want to have Bertha talk about what she is most proud about and the work she's done with many youth, because she's been doing this work for a long time, and success comes in different shapes and sizes in different parts of the organization. So you give us the big picture, Roberta, and then we're going to come zoom in with Bertha to talk about the things that she has seen that have been very successful, because this inspires people to want to work with groups like your own, right? Because they're saying, they get me, they understand me. And look what they did for my other colleagues, right? So Bertha, give us the big picture, what you're proud about with the organization, and then we're going to go over to Bertha.
I muted myself. Sorry about that. Yeah. I mean, I think in the years that I've been here, I'm most proud of the fact that we're very fluid. You know, when I first started with the organization, we were in Camp Gonzalez. We had social workers there, case managers there in the camp doing case management. And then we'd meet them at the gate. We had social workers on the outside, on the outs, as they say, meeting them at the gate when they came out, and we worked with reentry. Today, we're not inside camps. We are getting referrals from a lot of the public defenders, alternate public defenders, from probation officers themselves, other nonprofits, and of course, our youth who recommend, us to their friends. So we are getting referrals from all over. I'm really proud of the fact that we are the only nonprofit I know of in LA County that services all of LA County, except for, I'm going to carve out Antelope Valley because it's a little too far for us, but they are part of LA County. But we are all over LA County. Our case managers will drive. They drove over 30,000 miles last year just to meet youth and provide services. So we're very fluid. We're no longer in the camps, but we are out on the streets. And I am finding that I am so proud that we're able to still continue our case management approach on the outside, performing these reentry services and following up and what I call, finding better paths for our youth. The goal is to have them reach their full potential. That has never changed for over 18 years. We've been doing that. And so although the logistics changed, we are now, fluid in the streets. And I can see that our partnerships have changed as well. We're working with interventionists. We're working with arts, workshop people. And it's just so important that we stay current because our youth are changing as well. There's a lot more activity, a lot more guns on the street, a lot more drugs that kill. So we have to be current and we have to address the situation today. And I'm so proud of the fact that we are fluid enough to keep up. We are keeping up with these youth.
I love that. Well, you're absolutely right, Roberta. You're absolutely right. You're adapting yourself to the youth that you serve, their realities and the way they look in the system, the way that it looks now, because it looks different than it was in the past. But your flexibility, your adaptability is really critical, because then that means you're responding to the needs of the people you serve, right? The young, the youth and the young adults particularly. And so thank you for sharing that. That's a strong message for saying we're listening to your needs.
Yeah.
And then we're doing the work that helps address those needs. So finding a place for youth to live or to work or to be able to be productive in society in whatever shape or size that looks. So that's just a great example. And I'm glad you're proud about it, because I know when people talk about what they're prideful about, they kind of shine because they know that that's what's driving their passion to do the work. And then we have folks like Bertha, who for years has actually been, as you said, the boots on the ground, the person knocking on the doors, the person over at those community events, the one who's meeting with people in the community and working with the youth right where they're at, wherever that physically is. And Bertha, what are the interventions that you can say you're most proud about, right? Because when people say you make a difference, you take great pride in that, right? Because, just as we have pride in anything else in our life, right? Our kids, they're graduating from kindergarten or high school, or from getting their first job, right? Whatever the case is, that pride is what builds our resiliency, it builds our protective factors. But what are you most proud about in the work that you've done?
I think being able to get our youth from meeting them where they're at to being able to be successful in different areas, right? Like Roberta said, it looks different for each youth. Sometimes the smallest milestones that that they get, it's a proud moment, just to see like, oh my God, this kid would not get up for school, and what do I need to do for you, to help you, and sometimes they have the parents are waking them up, doing all these things, but the kids usually don't want to listen to the parents, but they'll listen to someone else, so helping them understand that, what, we are that person for you, and making sure that they're waking up by calling them, texting them, blowing up their phones, going knocking on their door, wherever, whatever it is that they need, like we're able to do it for them. We're able to help them. I get up at 7 a.m, drop off my own kids to school, and then I start making my rounds. Um, my job is not a 9 to 5 job. My job is 24 hours. I'm on call. you know if my youth needs me, I'm going to be there, regardless of what it looks like. Just helping them understand that, we are going to be there, and that opens up a path for a lot of our stuff. Just graduating, a simple graduation where kids that don't even think that, what, we're able to graduate. We have a few kids that are graduating this today, tomorrow, I mean today and Thursday. So just being able to be present with them, it's amazing. I won't be able to be present, but I'm going to be on FaceTime because I have COVID, unfortunately. So I'm going to be on FaceTime, letting them know that I'm there supporting them. And they want us to be there. They're like, who cares? Oh my God, COVID's not what it was before, just come, miss. And I'm just like, no, I have to be responsible. We can't do that. And at the same time educate our youth, right? Not to be so, so quick to be like, who cares? This is real. COVID is real. So being able to do these things with them. I have a young man that in Silmar, that we were doing everything we could do for him as far as services, counseling, and everything. And he didn't want to open up with the therapist, but he opened up with me. So being able to work hand in hand with that therapist, and without how could I say, without breaking confidentiality with my youth, and him knowing like exactly what I'm going to tell the therapist, built a bond with us. Unfortunately, my youth right now ended up back in jail, because they didn't want to listen to what we had to say. Well, what I had to say, which was my youth was not ready to be, put in placement. Of course, I didn't want my youth incarcerated, but I also knew that, he wasn't ready to come out, and be placed in the same situation that that he had found himself in, that led him to be incarcerated, right? Which was homelessness, which was, a gang infested location, where parents were not able to find housing, so not being able to stick my youth back in that those circumstances. I opted for my youth to continue to be incarcerated, for a little bit more time, where I'm able to work with the parents. Unfortunately, mom was on drugs, stepdad was on drugs, so it was a challenge for me. But if we don't address the situations, as with all the way back to where leads us to our youth's roots, then we're not going to be able to get these youth to do anything productive, because they don't have anything productive to do. My youth ended up in prison. I mean, in Silmar, and for a murder allegedly that that he that they're accusing him of, and he graduated, from high school, and it was so awesome that the judge got off the bench and congratulated him. For a moment, he made this kid, because I asked him, like, how did you feel? And he said, miss, he said, I felt like, I was human. Like I wasn't this animal that they were just locking up and they just wanted to throw away the key. Like he actually saw me, you know, and I think that that's one of the things that, you know, a lot of our kids don't feel, that we see them, you know, as adults, we want to dictate everything that they have to do instead of like helping them, lead them, you know, for them to find their strengths and the potential that they have, you know, and lead them to find it themselves, you know, by guiding them instead of like, you need to do this and you have to do that. And this is what's good for you. And this is what's not. That's not going to work, you know? So being able to see these accomplishments for our youth, it fills my heart with joy. You know, I have another youth that just started today, her training. She's in Florida. This is one of our youth that's foster, you know, and she's in Florida. She left on Sunday and she started her training, and she's a flight attendant, you know, and we laugh because, you know, she always ran from her problems, you know, and she's adventurous and she knows, you know, so it's like, how do we play on her strengths? You know, how do we get this youth, and how do we play in her strengths? Okay, she likes to, you know, she's adventurous. She likes to do all these things. She likes to be everywhere. She wants to go places. Okay, so how about, you know, what is it that you want to do? Look, you could be a flight attendant. You could be, you know, different things. And she said, oh my God, miss, a flight attendant. I would love to do that. We played on that. And now she's, you know, in her training as a flight attendant. So, you know, I'm keeping tabs on her. I've kept tabs on her from New York to everywhere. I've been working with her for a little bit over 2 years, and being able to see these youth, and I can tell you a lot more of different youth, but you know, these are the ones that are sticking out to me right now. That
Sure,
you know,
sure.
that are proud moments that you're able to take one kid from, you know, doing all this ruckus and, you know, this damage to themselves, to being able to be like, oh my God, you know, I'm able to do this. There's so many things I can do with myself, you know, than just, you know, sit there and not do, you know, anything productive with myself.
Well, I guess next time I'm on a plane, I might want to see if I might recognize her somehow, right? So
Yeah.
because that's a fabulous story, by the way. Fabulous story because, you know, uh oftentimes, you know, when people have dreams or they envision their life a certain way, uh it's not uncommon for people to say, well, that's not going to happen, or oh no, you should do something else. You know, everybody's trying to distract you from what you're seeing. And that's a beautiful example of when a person is aspiring to something, is not to take away the aspiration, but to inspire them to achieve it, because then they feel like they have permission
Yeah.
rather than being told you can't do that. Just beautiful story. Those just phenomenal. So now let's talk about something really serious, because this is impacting our nation. And it's even a global phenomenon, right? And it's something called stigma. And stigma has this pretty nasty habit of doing something, right? What it does, it actually puts a label on people. It makes that person feel less than. It's intended to tell that person, you know, there's something wrong with you, that, you know, you really, you know, you really aren't a productive person. And then the stigma starts to weigh heavily on the person because it's something being put on them, right? People don't usually look and say, hey, I want to be stigmatized. Put me at the front of the line. This is what's happening to people in our country, particularly people who are experiencing things such as disabilities, mental health issues, addictions, individuals who have had criminal activities in their past or have been, you know, called felons, and the list kind of goes on, right? So stigmatization is this phenomenon that is going to impact a lot of people. So what can we say and do, and what does your organization say and do? So Roberta, I'm going to have you chime in too, right? So think about, you know, and you gave a great example. Your training as a CPA in business and finance, but you probably have heard about how stigma impacts your own community, right? And you're saying, gosh, it's a very powerful force, right? So I'm going to start with you, Roberta, and then we're going to go over to Bertha to talk about how she combats stigma. So Roberta, please go ahead.
That's great. This is a great question, and it's something that more people should be talking about. You know, I practice what our counselors practice. And that is, although it's one youth at a time, my idea is one person at a time. My board is made up of people who don't really live, in the communities we serve, right? And it's important that they get to see and know who we're working with, who are we trying to support. And so I introduce them to some of our youth. I bring our youth to some of the board meetings and I have them, talk and listen and hear. And it's very surprising to me, but, it's enlightening to them, because when else would they encounter some of our youth? I also hire our youth here as youth navigators. So we train them in-house how to work in the office, how to outreach to other youth, how to show up. You are examples of your peers. And so through this internship that we have, they are learning and developing and training, all the while they're still our clients. But in the meantime, I am making sure that they are growing, that we are giving them a place to become leaders for their peers. So just between the board and our interns, I feel I am making a difference. And this is getting rid of the stigma. Until you know a person, it's very difficult to say, it's those people, or they are like that, or they look different. Of course, we see it every day, right? We see it in our work. But I feel that even though I'm in the office, there is something I can do, and that is to introduce our population to the rest of the community that I have access to, so they get to see, hey, we're not all bad. They're all not bad kids just because they come from that community. They have brains, they have hearts, and they can do also. So that's what I try to do, is I try wherever I can, I sort of insert a little knowledge so the ignorance goes away, becomes less and less, and they get to see that it is okay to not run from this youth who's dressed differently, or be afraid of all youths who look this way. And that's what I do on a day-to-day basis. I try to make sure that I integrate and I teach.
Oh, wow. Yeah. Talk about inclusivity, right? Being inclusive, right? What a great example of contrasting stigma, because stigma is intended to exclude people. So you're doing exactly the opposite of it, right? What you're doing is you're including the youth, providing youth internships, and I love the description of youth navigators, and then in creating contact. You're absolutely right. When you don't know a person, you fill in the blanks, right? And that fill in the blanks is the opportunity for bias and stereotype and assumptions. But you're doing the opposite, right? You're creating contacts so board members or other individuals in the organization get to know who we're talking about. So it's not about them, it's so we can actually have a conversation with them. So all I could say is I can see why you're in a leadership role, to help model that and to help facilitate that. And then here's what it looks like on the streets, right? Is the youth oftentimes take on that stigma in a way that's unhealthy for them. It's a burden that they have to carry, and it's not something they generated, but they have to deal with it, right? And Bertha, so how do you address the concept of stigma, even if you don't use that word? Because oftentimes people say, what do you mean stigma? What is that, right? But the truth of it is, because of the way it impacts the person, right, is how would you help a person feel empowered to help push away, shield themselves, or confront the stigma when it happens, right? Because the youth are pretty perceptive. They don't get the right vibe. They're the ones that are going to say, I'm not sure I want to be exposed to this person, because that toxicity is what it is, right? So, Bertha, tell us a little bit how you combat the stigma when you provide services there at the agency.
I think being able to educate our youth. I usually open up with our youth about therapy, and I'll usually just kind of bullshit them around to it and be like, oh, I have therapy today, just kind of to throw it out there and see what their thoughts are about it. Even though I am in therapy once a week, faithfully. And sometimes even more, because like I said, sometimes there's things that come up that I want to be able to work through before I transmit that to my youth. So I'm able to, I'm able to throw that in there, and I kind of get feedback of like, oh, Miss, you're weak. Like, what do you mean you're in therapy? And Miss, like, don't they look at you different? And you get all these, these questions that they're telling you, and I tell them, I say, it looks different for everyone, and start educating our youth, by looking up things or giving them pamphlets or taking them for them to get their, therapy on their own, introducing it to the families and helping them. I have one youth that, very depressed, you know, and they often call her lazy and she doesn't want to do this and she's not, and it's just like she's depressed, it's and kind of educating the mom, and the siblings about it. And it's like, I'm not trying to, because they usually say you're making an excuse for her, and I'm like, no, no, I'm not making an excuse. I don't talk about these things with my youth present, but I do have separate conversations with the mom and and other people that are around her, and kind of help them, educate them, and understand that it's not just that she's being lazy or these, like, she's really struggling to wake up, to get up, to do for herself, for her hygiene and things like that. It's not it's like we have to steer away from those words that are labeling our kids of of being lazy, or they're troubled, or they're just they don't know how to behave, and they're animals, and they're this and they're that. It's no, there's trauma behind all of this, and if we don't start healing all the way from the top to the bottom, we're gonna still have these broken communities. So being able to educate them and try to help them understand that we all come from trauma, and what trauma means, what these traumatic events that have led us to being traumatized in our life, helping them, educate them with that. It's hard to do, but it's not impossible. We are able to get through to some kids. Some kids are not. One of the things that I'm struggling with right now within my personal life, as well as with the community, is that there's a shortage on mental health providers, and it's like, okay, so where do we send our kids? How do we get our kids to talk to someone if when we find somewhere to talk to them, you're putting them on waiting list? You're putting them on waiting lists. You're telling them to call back. You're telling them that there's no services. We'll call the hotline, and it's like, that's where we come in, and we're just like, okay, we might not be therapists, but let's find this together. Let's look through this. Let's figure some stuff out. I call my therapist all the time, and I'm like, how do I address the situation with my youth? Because we can't get services right now. Where do I call? How do I do this? How do I navigate through this? Even when there's just crisis, because we deal with a lot of crisis. Our youth are always on crisis, so being able to get them, to calm down and talk about these situations and process it, and being able to get them from point A to point B, like, it's a great feeling to be able to say, at least this youth, for right now, we could say that he's a little bit stable until we're able to get them through the mental services that they desperately need and are seeking, and helping them understand that it's okay. It's not being weak, but being able to say, like, what, this is brave of me to be able to seek the services and not care about it when anybody's looking at me, because it's my own, it's for me. It's not for nobody else. It's for me.
Wow. So that educational approach that you're talking about, about how to inform the youth, and kind of that unique way of introducing concepts about getting help, right? Because whatever the natural support system is for youth, sometimes that's been shattered or has been dismantled, and they're there without really kind of some knowledge about how to get help, or who to get help from, or what does that help look like, right? Because it may not necessarily be a physician or a psychiatrist, it may be a peer. And there are now efforts across the country to have more youth peer-driven programs, or youth-guided programs, where they themselves become the natural support system amongst themselves, and then they get to be trained on how to look for the signs and symptoms that create mental health problems, right? So it's great to hear that you're your approach is really to how to inform and educate. And you said something really important. And I'm going to just ask this question because you pointed out something that is happening across LA County and across California and across the nation, and that's the shortage of behavioral health clinicians across the country. And so, how is it that we will go about building that workforce? And you had a great, you were touching the nerve center of that, right? I.e., youth development. Because at some point, those of us in the field were young, right? And so what was it that was appealing to us to be in the field, right? So if I've been in it for 40 years, right, and you all have been in it for X number of years, something draws us into that early on inside of that pipeline. So I thank you for bringing it up because I think it's really the challenge in our system of care. But I appreciate you putting focus on the youth aspects so that we can actually cultivate and really support having more youth become natural helpers to enter into the field because they have an intimate knowledge of these conditions, the traumas that lead to all these behavioral health conditions that then lead to mental health problems. And they're perfect advisors for us in the profession, right? They can become part of the workforce. And I'll end with this. I've heard it said that we will be turning more to the community so we can have an all community approach to supporting our communities with the mental health issues confronting the community. So it's not just licensed clinicians, but it'll be other members of society and the communities that are providing supports that naturally fit into the lives of the persons who are struggling with issues. So this has been just phenomenal. You've excited me to always keep in mind that the work that's being done is also inspiring, right? Despite the challenges, it's also inspiring. So here we are. I want you now to, give us a takeaway, right? So Roberta and Bertha, I'd like you to now leave us with the takeaway because since we're recording this live, we're going to want to keep playing this recorded version so then people can actually hear your advice, right? What is it that you would like to make sure people know about how to get your services, right? Because that's the key, right? There's a need and there are services. So help us now connect people out in your community to your services so we can leave that as the takeaway for today. And I'll start with you, Roberta, and then have Bertha do the same. And that'll get us to almost the end of the Plática. I can't believe we're almost there already, but so Roberta, over to you.
Yes, the easiest way I think is just contact us directly. I don't know if you can post the website, but hopefully somewhere in this you can post the website. You can reach out to us at info@c-youth.org. We are definitely reachable, no questions. If you know youth, who probably need our support, hopefully they're in LA County. Certainly feel free to refer them to us. I would say, my parting words though is really, if you just look around, we're all in this together. And especially when they're vulnerable despite the, big way they act or their facade of their, that they're somebody. Inside, they're still young people, right? They're still youth. And if you can get to them as Bertha and our other case managers can, where there's trust, you're going to see that facade break down. They just become little kids is really what they are. And this is a time for us, I think, to make sure we're there to catch them, make sure we're there to be that, person who hears them, to say, I see you. Yes. So all I can say is don't turn away, always lean in and try to, help them. And we're here to help. There's a lot of other organizations that provide services too. But, like I'm trying to do, introduce our youth to the rest of the world. Don't turn away.
Beautiful. Wow, powerful. That's awesome, Roberta. And so Bertha, you get to do the same, right? Here you are making yourself available to serve youth. So how can youth and even their families reach out to you? How do they connect to you? Give them the recipe for how to connect to you, right? Because because this gets to replay and replay. And for the folks who are going to listen to this after today, it's an opportunity for them to know how to connect to you. So kind of give us that recipe if you would.
Again, like Roberta said, that they could reach us on our website. Another thing is just come as you are, you know. Don't be somebody you're not, you know. Hurt people, you know, and it's okay. We're not here to judge you. We're not here to, you know, to try to change you, but educate you, you know, on the what ifs. You know, there is another world out there, you know. And I think if we're giving the opportunity to our youth, you know, to explore the, you know, the other side of the world, you know, without judgment, and being able to provide, you know, them to an understanding of how, you know, how to explore these other areas in their lives, you know. Come as you are, you know. Just come as you are. Don't try to be somebody you're not. Don't try to pretend, you know. We're in a place that we're in a safe place, you know. We provide you a safe place, you know. So just man, just come, you know. Just, we welcome everyone. Just come.
There it is. I guess you might have a new logo now. Come as you are, right? But well said, right? It's about how welcoming it is. And one of your strengths as an organization is the outreach that you do, and particularly in Latino communities, right? And even other communities for that matter, the outreach, being in their space, in their environments, being in those spaces is where the welcoming starts. Not the welcome mat at the organization necessarily, but out in the community. Because the kids will talk about the program, right? They're your biggest promoters and marketers, right? Because they're going to say, yeah, you know, I was in a pinch and man, they really helped me understand what was going on and, you know, what I needed to think about doing different. And this is what I did. But they always want to give credit where credit is due. The one thing about youth is they're very good about calling a spade, right? They call it as they see it. But what's beautiful is then there's you all to be able to support them in that journey of healing and recovery. And all I could say is that the work you're doing is just phenomenal. I just want to say thank you to the two of you for being here with us live on Facebook. And we're going to continue to play the recorded version of today's session on today's Plática on Take Action for Mental Health LA County. And more importantly, we're going to continue to do these through the rest of the month. And what we have found is just a positive energy about the providers that are making themselves available to provide services. And then I think what's inspiring is the way you do it all, right? It's very unique to your organization and your leadership and your team, your governing body, and then you as a whole. So again, I want to say thank you to the two of you for being here with us today. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. I invite you to join us for our live Facebook Pláticas. And then more importantly, let's fight this stigma together. It helps us as a community or as families and a nation to recover, to heal, and to be able to lead healthy lives so that we can have children who in the future will be able to take great pride in what we did to support their futures. So with that, muchísimas gracias. Thank you all for being here with us today. And with that, take care.